My name is Doug Tatro with TAC, and we're going to be jumping into our second session of 5 sessions focused on housing first practices today, with a little bit more bent toward systems, which also includes program types and components that we'll dig deeper into as we go along. We'll also discuss briefly document readiness, but we'll probably also discuss that in more detail when we get into the specific program types that have different types of documentation needs. If folks could mute their lines, that would be appreciated for now. Feel free to use the chat for questions. We will have a couple of thought points to hear from the audience as well. So with that, we'll jump right in. As I mentioned, my name is Doug Tatro. I'm with the Technical Assistance Collaborative, and we've partnered with the state of New Hampshire over the years in different efforts, but more broadly, our team works throughout the country on all things homelessness and affordable housing, and systems that support people with disabilities and other marginalized groups. So we do work in many different states, but I am from New Hampshire, as I always say on these calls, so it's nice to be with my hometown crew. I'm joined here today, as in last time, by Chelsea Mahoney, who's also with TAC. And Chelsea, do you want to introduce yourself?
Yes, good morning, everyone. Chelsea Mahoney with TAC. I am based out of Raleigh, North Carolina. I'm glad to be working with you all.
Thank you, Chelsea. And I'm going to turn to Chelsea in just a moment. This is the general arc of, and I know there's 2 number 1s here. We tried to fix that and it didn't work. Last time we were together about a month ago, we gave a basic overview of the core principles of Housing First, some of the history of the Housing First philosophy, both from a PSH originating with permanent supportive housing as a sort of defined model, and then using those same principles and approaches to then transcend into broader system of care that you all are working within, from outreach and shelter all the way through PSH. And today, we're going to dive a little bit more into how those different types of programs and components contribute to a housing first system environment. And then in subsequent sessions, we'll focus more so. We've got a slide on each of these different types of projects today. We'll dig into those in much more detail in future sessions. So today we're talking about system level housing focused practices. So as Christy mentioned, we'll talk about those components. We'll rehash a little bit around what Housing First is. We'll talk a little bit about equity and bringing in folks with lived experience and quality engagement strategies, a little bit on coordinated entry, and some of with a coordinated entry discussion, I'll invite to our partners from New Hampshire and from you all to chat as well, because you've continued to make improvements and changes to your coordinated entry process over the last couple of years. But that's where we are today. So we'll plan these monthly. We skip, I think it's July or August, one of those months we take off, but those should be on your calendar. So you can see that agenda here. We do really strongly encourage folks to use the chat to communicate with us, and then come off mute during the portions where we are going to stop with some questions for folks to reflect on. This is a 90-minute training. We know that's a lot on a busy Wednesday, but we hope you'll stick with us. And I do believe it looks like this is being recorded and transcribed for folks that either need to duck out early or are multitasking or need to share this with your partners or staff. With that, I think this is already prompted in the chat to make sure you're putting your name and organization. If you choose to include your pronouns or other identities, feel free. That is part of the attendance for this session, as well as just a good way to introduce ourselves. And if you also want to put how you would describe New Hampshire in 2 words, I'll do that in a moment when I hand it to Chelsea. But go ahead and put those in there. We can see who's on the line and what you think about our state. So I'll keep an eye on that as we go. And with that, just to jump right in, I'm going to give it over to Chelsea, who's going to kick us off for the first part of this presentation. Chelsea, I have the slides. Let me know when you're ready for me to move them, and I will do so, and I'll give it to you.
Thanks, Doug. You can go ahead and go to the next slide. So like Doug said, we're talking about Housing First. The last session, we discussed the difference between Housing First approach and its framework, but we want to level set and redefine it for everyone. So Housing First is an approach and framework that is centered on the belief that everyone can achieve housing stability. That means that there's no prerequisites to housing, and the fundamental belief that stable housing is a foundational platform for pursuing other health and recovering goals. As we continue to further in this discussion, we're going to talk about housing first from the approach standpoint. And there's 4 key components to that. That's that we quickly connect those experiencing housing crisis to permanent housing. We believe that all participants are housing ready. The goal is to quickly get them there and exit them out of that housing crisis. There will be no preconditions based on sobriety or any other treatment-oriented goals to get into housing. We believe in wrapping with supports to maintain that housing stability and understand that the homelessness is the crisis situation that we need to resolve quickly. Next slide. So once again, like Doug mentioned, this session, we're discussing housing first from a systems level. And when we're talking systems level, we're talking about how does the system adapt to the clients, the participants, those experiencing the housing crisis. Is the system client ready? Once we engage, do we know how to quickly get them to access and engage within the system and then get through the system, connect them to permanent housing rapidly? And then is the system data driven in using equity practices? When we start talking program level, that's when we're talking about our programs adapting to the client's needs, removing barriers to access and services within the program, making sure that our goal planning are person-centered, honoring how the person's choice, the participant's choice is a housing first principle. And then engaging in services is a voluntary action. It's not something that is required in order to obtain permanent housing. Next slide. So when discussing the system level, there's several qualities of a community that uses housing first approach. Once again, that is housing crisis focused and rapid intervention ready. Understanding that our homeless participants that are engaging with our system, they're currently within a housing crisis. Treatment and prerequisite services are not needed. The goal is to get them to permanent housing as quickly as possible, understanding that we want to honor the participant's choice, their housing choices, their location, the services that they want to engage in, and how often or the frequency is all a part of how we plan to engage with them throughout our system and connect them to services. When we're talking about the services within our system, we want to make sure that we have the right resources for our population. We want to make sure that we can engage them at the right time and the right amount of time. That's the idea of progressive engagement. Understanding that everybody doesn't need everything up front. But when they do need it, how do we get it to them? Are we progressively engaging them, stepping them up to the appropriate services at the right time and stepping down? That's also us dynamically using our resources within our community. And then ensuring programs across our system are client ready. As a system, we need to make sure that every program within it has the capability to provide the right supports to our clients, and that includes street outreach, shelter, transitional housing, and other services that are meant to permanently house our participants. Next slide. We also want to make sure, like we said, those in the housing crisis situation, it's traumatic. So we want to make sure that access to our system is user friendly. Are we making sure that those that most need our system know how to engage it? Are we limiting the frustration and the barriers to connect with our coordinated entry system and thus get housing related services? When they're engaging with our system, are we using rapid resolution techniques, making sure that we're assessing the participant and their family for any familial support, social networks, alternative safe housing options, so they do not have to enter into the trauma or engage in the traumas of our housing system to begin with. If they do have to engage with our crisis-like services such as shelter and street outreach, making sure that we have safe opportunities to engage with our participants, that those services are low barrier and are easily accessible within the coordinated entry system to obtain housing. And then making sure throughout, as we do all of our projects, planning, engaging our programs, that everything is data driven as we're prioritizing participants and connecting them to housing services. Next slide. We're making sure that, once again, like we said, our providers are housing are participant ready within our system, and we know how to connect them via referrals. The providers are ready to accept referrals and work to house people as quick as possible. Also, across our system, are we creating any standardized practices, any standardized applications or screening processes to remove restrictive criteria, ensuring that we're being trauma informed and making sure that we mitigate any barriers that are not necessary for our participants to access permanent housing. And then making sure that our policymakers, our funders, and providers are all together at the table as we continue to plan and develop future resources and align our practices to increase availability and affordability when it comes to supportive housing or permanent housing within our community, understanding our mainstream services and being able to maximize housing choice for our participants, making sure we're all coming together at the table, seeing how our services align and how we can connect them to ensure that we are mitigating and limiting the length of time a participant has to remain homeless. Next slide. Also, we want to make sure that we're connecting with other mainstream systems, right? Housing homelessness does not happen in a silo. Oftentimes people are experiencing several different challenges. And so how are we connecting with other social, behavioral, mental, physical health communities doing income maximization systems or benefit and entitlement programs to ensure that we're able to wrap around with appropriate supports to help those that are experiencing homelessness and getting into permanent housing. We want to make sure that as we're working to kind of cross-pollinate these systems, that we're helping to eliminate some of those barriers while still remaining housing first within our housing system, but trying to get those supports within the other systems so that our participants can have all the services that they need. And then also making sure that we're considering staffing across the entire system, making sure that people are trained appropriately in evidence-based practices for client and tenant engagement. We're utilizing motivational interviewing, harm reduction techniques, client-centered counseling, critical time intervention, and trauma-informed care. Next slide. You can keep going. So when we're talking about programs across the system, which you all are aware of the programs that you have within your coordinated system, but from a high level, we're going to break down each component and how we can use housing first approach. So when we're talking about outreach, we're saying that outreach programs across the system should be low barrier. There's to be able to access our outreach services. There should be limited restrictions, especially on things such as substance use and mental health or criminal history. We want to make sure that our staff are representative of the population that they serve. Once again, right, we're talking about understanding equity within the situation, understanding the historical components that come with it, and making sure that our staff are representative of the population that we're serving. We also want to make sure that we're always constantly evolving our system, involving how we engage with participants, how we do outreach services based on the necessities of housing, housing navigation services, and of course, the demographics of the population that we serve. Once again, that notion of no preconditions or other recovery goals needed to engage in services, that's going to be seen throughout our system components, making sure that we're trauma informed in our approaches and reduce or avoid re-traumatization when we're gathering information, and how do we appropriately share that information to not re-traumatize as they work their way through the system. And then once again, that proactive coverage, making sure we're knowing where to engage our participants to make access available for everyone. We want to make sure access, especially in outlying communities, that we don't have this situation of invisible homelessness, that we don't connect with the homeless participants in a certain community simply because we're not looking, we're not engaging in the appropriate coverage areas. Taking time to think about cultural and religious specific locations that we may be able to engage participants that typically would not come to other areas where we tend to find our homeless population. Next slide. When it comes to shelter, we're also talking about that being low barrier, without restrictions, of substance use or criminal history. Once again, when we're in shelter, rapid resolution efforts do not stop. That is something that can be carried on throughout the life cycle of a participant within our system. So in the shelter, are we engaging in diversion efforts? Are we problem solving with other community supports? Constantly assessing social and familial situations to see how can we support them, to get them quickly out of this current housing crisis. Also, are we honoring the participant's choice, making sure that we are accessible at varying times of the day based on kind of their schedule and activities that they have? Are we honoring employment needs, of the time of day they can work, location, or other personal needs without punishment or loss of services? Are we accommodating to the participants' needs to help them achieve their identified goals? Also, do we have adequate coverage in shelter, specifically thinking about women, LGBTQ, older adults, those with significant health needs? Are we able to care for them within our shelter system? Are we able to address safety concerns once again when we're talking about our women, older individuals, and those engaged in our shelter system, with housing case management services? Do we provide marketing and outreach for vulnerable populations, including marginalized populations? So once again, they know how to access services, where to access services, or just the understanding that the services are there. And then shelter staff, much like the remainder of our programs, making sure that the staff is diverse, and represents the population that we are serving. Next slide. So in the last slide, I briefly talked about diversion, and that's an intervention that is meant to prevent entry into our homeless system or immediately resolve a household's homelessness once they enter shelter or transitional housing or any unsheltered situation. Diversion is a conversation that you're having throughout your case management services while the participant is engaged in your system constantly, to ensure that we are able to provide the right supportive services. If they need financial assistance, we're able to provide brief financial assistance to help households identify alternative housing options or even temporary options that will get them out of our crisis service, such as shelter, and into a more safe, stable, temporary option until we're able to get them into permanent housing. And diversion efforts are known to reduce the trauma and expense associated with extended periods of homelessness and the strain on crisis response systems and affordable housing resources within the community. Next slide. And then Housing First within rapid rehousing programs. Some key approaches there are making sure that we're using all the flexibilities that are allowed within our programs. Are we ensuring that rental assistance practices can fully meet the needs of our participants with little to no income at entry? Are we targeting landlords to make sure that the housing options that we are getting are actually conducive to the participants that are engaged in our program? Coordinating appropriately with those partnerships to make sure also that our landlords are more prone to screen our participants in, and then instead of screening them out. So how can we not only be a low barrier housing program, but connect to low barrier landlords. Are we making sure that adequate staff budgets are there to ensure a full range of supportive services, or connecting to other programs? Do we have good connections to other programs within our system that can wrap around our participants with supportive services if we're not able to do it in-house? Are we also frequently adjusting financial and budget projections to adapt to the need of our community and the participants? And then when it comes to exit planning, are we considering marginalized groups that may face greater challenges in retaining housing? So once again, looking from a high level, but not just a client perspective, as a program, are we following the data to see what has been working when we're targeting landlords, what has been working when we're talking about provision of financial assistance and other supportive services, not just for obtaining housing, but for the maintenance of housing. And then when we exit participants from our program, are we noticing any disparities in certain populations? Are we noticing a certain group having challenges in retaining housing long term? And what changes may we need to make to our program to support that? Also, our programs need to be sure to participate in coordinated entry, including serving clients prioritized for PSH. But also when PSH is not available, right? We need to have somewhere else to ensure that we're still focusing on permanent housing with our participants and not saying, okay, well, this program is not available. We're just going to hold this participant in their current housing crisis until it becomes available. How do we bridge our participants from a rapid rehousing program to a PSH or any other programs to ensure that we are supporting them? And then also employing people with lived experience at all levels of the organization, including our rapid rehousing programs. And we're going to speak a little bit more throughout the system to ensure that we're focusing on participant choice, that we're considering accessibility, that we're considering prioritization and just taking into consideration their lived expertise and how it may help us to make a more dynamic system. Next slide. So Housing First and permanent supportive housing, once again, that's designated for those individuals with the highest level of vulnerabilities, housing barriers, and longest term of homelessness. We should promote direct access to housing from the streets, shelter, or places not meant for human habitation. This is, like we talked about in the last session, switching from that stair-step model that first you need to get connected to your services. First, we need to make sure that your treatment is in order. Then we're going to get you in the shelter, then connected to permanent housing. This is saying we believe in direct access from wherever we encounter you in your housing crisis to permanent housing, which the goal is to reduce paperwork and intake documents to only what the funders require, including avoidance of collecting unnecessary documentation beyond basic funding requirements to support housing goals, right? The goal is to get them into housing. And yes, we understand that there's so many other barriers, but we believe every client is housing ready. So let's get what's needed, required by the funder, required by our program, get them into permanent housing, and continue to collect documents as needed to ensure that we're still able to get them to maintain that housing for their long-term goals. There's low barrier access and retention policies within the program. Termination is going to be the last resort for PSH and many of our other programs. Sustaining tenancy is the goal and focusing on the client-defined goals as well. So how do we support them in their current housing? What supportive services do we need to wrap around them in their home to make sure that they're able to maintain that housing? If they violate their lease and it does turn into an eviction, that does not mean termination from the program, but how can we support them with what do we need to address? What goals may need to be changed in order for their next housing goal to be a long-term housing placement? It should be robust and flexible with multidisciplinary teams or access to multidisciplinary teams within the community to support all the needs and services that they'll have to maintain that long-term housing stability, and then making sure, once again, employing those with lived experience at all levels of the organization. Next slide. So when it comes to mainstream and retention, there's a continued focus on, and I think we meant maintenance and retention, on housing retention as a primary service goal, with focus on overcoming tenancy barriers and avoiding situations that would lead to eviction. So this is as we assess our participants within the program, and we're looking at our programs from a high level. What are we noticing as many challenges to retention, right? Sometimes we can find trends within our program. There's certain tenancy barriers that we notice within a rapid rehousing program or a permanent supportive housing program that may lead to evictions. As a program, as a community, what are we doing to support our participants and make sure that we have adequate supports and ways to address those barriers? Are we relying on roommate or other creative arrangements to create long-term affordability and support in networks in housing and communities? I know here in Raleigh, a lot of challenge that we had was some of our participants would say we're moved into the community with no support, no one that understands our housing situation. And over the last 10 years, we've really beefed up our shared living. And that has definitely helped with our long-term housing stability. So once again, not just from a client-centered perspective, but as a system, as a community, we noticed trends in how do we address those barriers in a system level. And that took a lot of engagement with landlords and programs to engage in shared living toolkits and trainings across our community. When we're doing exit planning, is it focused on the ability to retain a unit and access mainstream or specialized results? So are we connecting to those supportive services and coordinating efforts to make sure that our benefits are there, our supports are there to maintain housing in the long term? Are we creating partnerships with our housing owners and PHAs to create priorities for mainstream vouchers for people experiencing homelessness or transitioning from housing-related programs? And then are we also educating our staff for community-related or historical racism or mistreatment of marginalized groups and strategies to ensure fair access to housing regardless of population type? Next slide. And we just wanted to put this in here, a note about sober living. We want to make sure that it is not antithetical of the Housing First model. There's a few things that we want you to consider if a participant chooses sober living. We want to make sure that it's a part of their housing plan and they've been afforded other housing options that do not require sobriety. We want to make sure that the recovery-based housing options are not the only option we're providing to them. We want to make sure that termination and eviction policies heavily lean towards preserving program enrollment and prevention. And if for some reason that this particular recovery-based housing setting is not appropriate for someone, that the program they're enrolled in actively relocates and provides housing navigation services before termination. We believe that the participant should have tenant rights in a permanent housing setting or near full rights in non-permanent housing settings. Next slide. So if you noticed in every component of the system, we discussed lived experience, including those with lived experience into how we are engaging and directing the system, and including those with lived experience as a part of the system stakeholders can help advance equity throughout our homeless system by engaging in meaningful engagements with those with lived experience and systems and programmatic implementations that are more relevant and responsive. When we're talking about equity, we're talking about the proportional representation of opportunities, representation by class or race or gender, of opportunities in housing and healthcare and employment, and all other indicators of healthy life. We've reached equity when we're talking about a particular demographic identification is no longer an indicator of housing, economic, or other health outcomes. So when we're talking about meaningfully engaging with those with lived experience, you can go to the next slide. The next two slides are just going to talk about, the difference between a meaningful engagement and an inauthentic engagement. The engaging those with lived experience is a twofold process. One, studies have shown that those engaged in lived experience, those that have come from housing crisis situations and then are asked to re-engage with the system in a leadership or advisory role, fosters the dignity and worth of a person. It helps them to have a meaningful connection, not to a system that they have just gone through, but helping to coordinate and evolve it to help meet the needs in a long term. And then from the systems perspective, we're really being able to identify more dynamically, how do we engage appropriately? Sometimes we don't know what we don't know. And coordination with those with lived experience helps us to broaden our horizons, think more deeply and dynamically about access, engagement, and prioritization efforts within our system, and also understand the ever-evolving challenges that are happening within our community from a different lens. So when we're talking about meaningful engagement, we're fostering relationships, we're creating a collaborative environment and including those willing to share as the highest priority. Next slide. We're also allowing opportunities for transparency, what worked and didn't work on both ends of the spectrum, sharing missteps with community members, and allowing opportunities for humility, dedication, but also improvement within the system. We also want to make sure that those meaningful engagements are happening, once again, right time, right place. Are we meeting outside of regular business hours? Are we considering the space that would be meaningful or helpful for our individuals with lived experience to be able to share comfortably in those spaces? And then understanding that contributions of those with lived experience are valued and prioritized, making sure that decision makers are in the room. So those with lived experience feels like it's not just a listening session, but they're really helping to make dynamic change within the system. Next slide. And I think you're taking over, Doug.
Yeah, thank you, Chelsea, very much for all of that. And there's some good chat happening as well. And Mandy, again, just raising up nothing for us without us, I think has been a really important theme that we've seen across communities. What we did want to open this up a little bit and kind of pause our slide rotation here and get some input from you. And I think even your system leadership, Christy at the helm for coordinated entry. I know that has continued to change, and you commented a little bit, Christy, but we do have these couple of questions for discussion, either in the chat or coming off mute. The first being more about the larger policies and procedures and how your overall court entry process, or New Hampshire's balance of state as a system, is targeting certain populations and prioritizing those populations within, with that theme of ensuring that those with the greatest housing barriers are prioritized for resources first. And then coming back down, that only works if we continue to reduce barriers to access. And one of the things that Chelsea mentioned across a number of the components that we see time and time and time again are programs that have an exorbitant sort of data collection processes that actually don't lead to anything productive, especially projects that are collecting data that goes far and above what your funders require. We often see intake packets of 15 and 20 pages worth of paper about somebody that when HUD or your funding source only requires a few data points. We wanted to open up this discussion. How are you as a group prioritizing certain populations? What does that look like? And then how, once those populations are prioritized, have you worked within your programs or even across partnerships to reduce barriers to access, getting folks document ready with minimal documentation requirements based on what your funding source says, and not necessarily layering on additional paperwork burdens that aren't necessary? So we're going to leave this question up, but I am going to give a pause and see if we have folks in the chat or who want to come off mute to discuss one or both of these questions and try to get some other voices besides mine and Chelsea at the table. So we'll pause there and see if we have any brave souls who want to jump in on these questions.
Go for it, Freeman.
Yes, Freeman, I see your hand.
Yeah, you could have guessed I'd be the loudmouth.
I should have just called on you, Freeman. I knew you'd start us off.
Hey,
I'm trying to keep my mouth shut.
Shy is not one of my traits. So how does our system target certain populations for a prioritization? Boy, well, I think that's something Christy and I and the boss CES subcommittee are trying to address and fix on a day-to-day basis. That's kind of the anima of everything we're doing right now, is making sure that we're targeting people in an equitable way so that everybody gets into the right type of housing, right? Because that's a theme I'm hearing a lot today, is making sure that not just housing first is fantastic, but when you live in a state that's not set up for it like ours, it becomes really tricky to do it properly. How do we reduce burdens to access, including minimal documentation and program rules? Anytime I'll use our housing stabilization fund as an example. Like we have reached out to like our friends at the Bureau of Homeless Services to figure out like, all right, what exactly do I have to require? Like, do I have to have someone go to welfare? Because that in itself could be a barrier. Is this application too long? Is there a way we could condense it but still meet the requirements of what it needs? Are we required to require certain types of identification, or is it really just something that makes us feel good? I do think that there's a lot of housing first programs that are operating within our state that won't enroll people unless they have all the IDs up front, and people miss out on housing opportunities as a result of not being able to secure the right types of documentation. So that in itself is not housing first, in my opinion, but there are other issues because there are certain requirements where we're required to produce certain types of documentation. So I think sometimes the documentation requirements are in direct contradiction of housing first, and they actually create the burdens to housing. The other piece I would add is when you're in an area, and we have done a good job building exclusive relationships with property owner agents that will do things like not run a background check and just understand that some of the people I'm working with are not going to have good credit or any credit, or may have legal entanglements or other barriers to housing, and that there's an agreement that we will, because we're a housing first program, that we will case manage these issues as problems arise, and we will case manage these issues in advance to prevent them from becoming a problem so that the participant's not re-traumatized. However, I do feel as though rapid rehousing programs and permanent supportive housing programs have become a dumping ground for the mentally ill. There's no one on my staff that is clinical, and there is a severe lack of PATH funding. So when we're talking earlier about having to have a robust system of multidisciplined professionals, I'm in agreement with that 110%. But like they said in that old movie, Jerry Maguire, show me the money. Because if you're not going to pay the CMHCs to do this work, and I'm not saying you, I'm just saying, the royal you, if you will, then these systems can't be put into place, right? And we're putting people into housing under a housing first model who are destined to be re-traumatized and be unhoused again because they're being placed into housing that even with our best wishes and intentions, they're not right for. They need some sort of stepping stone solution. So I guess what I would say is housing first is great, but you have to build the structure before it can work properly. I think in this state, all of the people on this call do a brilliant job at living housing first. I think that we're often met with really bad outcomes because the underlying foundation of what housing first should be, that support structure, that safety net, those multidisciplined professionals, like there's just not enough of them to shake a stick at all the people that we're serving that are suffering in ways that your average rapid rehousing team or permanent supportive housing team is not qualified, nor should they have to be qualified to address. And the other piece, and then I'll shut up, is the sober living piece. So sober living is one of the only options that is presented for a lot of the participants we're working with. We certainly never, ever, ever, ever require sobriety. People have heard me say this one a lot. I'm not here to tell people to stop using drugs. I don't care. If you can handle your stuff and you're kind to your spouse and you're paying your bills and you're showing up to case management, it matters not to me if you're using substances. I just want you to live long enough to get past that or help you be safe enough to continue using substances without it causing an adverse impact to your health or well-being. But sober living is a tool in our kit. In PSH, we can't even put somebody into sober living because they don't offer 1-year leases. So people simply, in the interest of housing first, it's not housing first to take an option off the table because it doesn't offer a 1-year lease. That to me is contradictory to housing first. So thoughts, feedback, tell me I'm wrong, please.
I just want to elevate. I appreciate all those comments, Freeman, and it looks like Mandy had put in the chat. Something I think is really important is that homeless services tend to be the result of other structural failures. So a lot of what we talk about is, your ability to do some of these things is based on other systems of care that simply aren't strong enough or robust enough in the state of New Hampshire, and frankly, in most states. I think we're probably kind of mid-level in New Hampshire in terms of like the commitment, the funding, the structures around community-based mental health and other types of outside mainstream resources. There are certainly states that do, frankly, much better than we do on those investments, and there are some states that do much worse. But regardless, it continues to be a challenge. I would also wanted to highlight from the chat the point that was made around trade-offs with serving fewer people. So with all of what Freeman said in mind, perhaps an unpopular opinion, but one that I hold, is that we often need to serve, given the level of need within the community and the lack of robust other mainstream resources, we often do need to serve maybe fewer people to be able to serve them well. And what we've seen, in different places is we try to maximize the overall number of participants because it makes us more competitive for our grant, or we say this amount of money can serve this number of people, and we feel held to that. And the resource that we can provide to those people, whether it's the service side of the house or the rental assistance and subsidy side of the house, is not enough to adequately serve them. So we have lots of people we don't serve well. And then to your point, Freeman, they get re-traumatized because they're evicted again, losing housing, and it becomes harder and harder to rehouse, right? So it is something to think about from the funder level on the line all the way down to those who are seeking these types of programs and designing them. What is the trade-off between your overall gross number of folks who are served versus being able to serve a smaller amount of people, but serve them better and be able to achieve better outcomes for those folks? That's always a constant tension that I think is important. And we're going to dive more deeply, I think, into some of that documentation piece that you brought up as well, Freeman. It was David, I think, that had a hand up. David, do you want to come off mute?
Yes. So thanks. Kind of echoing, because I work with Freeman's group quite a bit. The one question on here of how does your system target certain populations? I think we're trying to do a fairly good job here in New Hampshire with targeting just the veteran population by having outreach workers and teams go out with the other outreach people. So when we do come across veterans, we can we have the people in place on that team to work with them exclusively. So that is one thing. But as far as like Freeman said, reducing the amount of paperwork, I've got a perfect example with one that I'm trying to work with now. He was with another agency, but they can't serve him due to his service. And we're going to have to redo all of the paperwork that they've already done. So it's just a kind of a tough situation sometimes where you're stuck with the system requirements of what your agency needs as far as paperwork. I can't take their paperwork. I've got to redo a whole intake packet with this person that's been working with this agency for a month now. So that's one of the things we definitely need to look at is, can your paperwork cross over to mine so we don't have to have this person reinvent the wheel for sure.
Doug, I'm going to chime in for a hot
Yeah,
second.
please do. I was going to call you in on that one.
I'm
Thank
like
you.
twitching. So currently our system, for the COC projects and the youth projects, at least, we do target specific populations for those housing opportunities because we have domestic violence projects. We have a project for human trafficking, and we're building up our youth portfolio across the board. And I think most Waypoint is now doing youth coordinated entry across the balance of state, which is phenomenal. And we do have the veteran specific regional access point as well. We're not currently targeting them for prioritization, but they're prioritized based on the eligible permanent housing opens that we have. And I would say one of the big things that we're looking at as reducing burdens to access is utilizing case conferencing to get people document ready. So that when there is an opening, we have those documents, they're uploaded into HMIS and everyone has access to those so that we don't have to recreate the wheel, hopefully too much. But making sure we have all their vital docs, their homeless verifications, their disability verifications, and that those are uploaded into HMIS.
Christy, I'm gonna keep you off mute for a moment. And this is a little off topic, but you brought it up, and it's not in this session. One of the things that I think we've seen over the last decade of these court entry policies and requirements coming into play was this pendulum, right, between free for all, wherever you walk in a door, that's now your service package or not, to everything is going to be based on how we numerically score human beings and sort of spreadsheet and pretend we understand what they need. And I think New Hampshire has done a really nice job, and other states as well, in bringing that pendulum back toward the middle and balancing access, that documentation piece that you're continuing to work on, the assessment piece, but also case conferencing, which is that link, I think, between kind of a clinical or vulnerability assessment and the professional judgment that we all carry on this call to really talk about who these human beings really are versus a score. Could you just for anyone who may be on, there's 55 folks on the call, I have to think there's a couple maybe that aren't as familiar with where you are with case conferencing now, what that is meant to do for coordinated entry, because I am a firm believer that we need to continue to infuse that discussion as part of our prioritization and not only rely on scores. And I think that's a balance you've been trying to strike. So I hate to put you on the spot, Christy, but I think this is also a passion of yours I'm going to ask you for.
So case conferencing, we actually just talked about this at our internal bureau meeting on Monday. We currently have case conferencing in Sullivan, Cheshire, Merrimack, Belknap, and Western Rockingham counties. There's also veteran case conferencing and youth case conferencing as well. We're working on building up case conferencing in the other areas that we do not have it in yet. But what we really look at is identifying the most vulnerable people on those regional prioritization lists and having a conversation and trying to creatively problem solve housing solutions. And really looking at does this person need housing more than the other person, and what are we doing, and having those not really clinical conversations, but the conversations about why these people need housing, what else can we do to assist them, who can we connect them to. And we just had one yesterday, case conferencing, and we had several people who were connected to permanent housing, which is phenomenal. So we're really looking to grow that across the rest of the state, and it really does help having, I can probably tell you, like, everyone who is on every case conferencing list across the balance of states. So I can even, like, I don't have a face to a name, but I have a name for a number from each of my S. And I can tell you about these people and what they're going through. And so that we can really look at their vulnerabilities. Are they being prioritized correctly? And how can we help them get connected to housing? I feel like I got off topic and was rambling.
I think I got you off topic, Christy. That's okay.
It's okay.
Other folks that want to chime in on this conversation around how you're prioritizing, whether you're, and we can even bring this down, right? Systems rely on programs. If your program is in a position where it's difficult to accept those referrals or have had to adapt to accept referrals, what does that look like? Have you been able to reduce document burdens? I'll give an example as folks, continue to ponder if they're willing to come off mute. We were in a training for some veteran work recently, and we had the funders with us, and we were talking about numerous different things, one of which was same day access to programming. So rapid engagement and enrollment of projects. And a case manager raised their hand and said, why do we have to have a 30-page intake packet? And the response after the funder from the VA basically like fainted, right, was, you don't, and you need to talk to your boss and stop doing that, because we don't require a 30-page intake packet. They require, it's probably 2 or 3 pages worth of information in order to enroll somebody. So the barrier to just accessing basic services was entirely contained or primarily contained within the organization to Freeman's point, making the organization feel good about what they've collected, or feeling like they needed more than was actually going to contribute toward enrollment or ultimately their housing plan. Has anyone else worked through that or done audits of your intake documentation or internal policies that allow you to be more efficient with these types of intakes?
So I know Freeman wants to talk, but I'm going to VHS does review all your policies and procedures, and we've really tried to standardize all of the forms and say, why do you need this form? Like, this is what you need. And I know no one likes when I say this, but we technically have 45 days to collect all that documentation, even after they're enrolled in a COC project. And I know the hesitancy is to make sure that they're actually eligible for your projects, but we do have that time period, even if they're enrolled in a permanent housing project, to gather all that documentation. On the other hand, we're also really using case conferencing to get those documents up into HMIS that we absolutely need. Freeman, I'm going to be quiet now. It's your turn.
Welcome back.
Yeah, no, hey, everything you're saying is right, Christy. And that was kind of the point I tried to, make earlier, which is like, we can enroll somebody in a project, we can start assisting them, and sometimes when they're already in our house, so to speak, it's a lot easier to secure those documents rather than working through a third-party agency as a middle, an intermediary is the best way to say it. But what I was going to add, and it's pretty much in line with what Doug was saying, is that I'll give an example of a best practice that we've started employing not that long ago, which is many of our agencies offer many products, and that's kind of how I refer to our different grants or housing options. So we've started to leverage the ability to dual enroll people to increase better to add to better outcomes under that housing first philosophy, right? So if we're working with people that are already saddled with many things to overcome in order to gain housing stability, not the grants that we're serving people through, whether it be ESG rapid rehousing or the Continuum of Care permanent supportive housing that I oversee, or the State Housing Stabilization Fund for my agency, we found that sometimes just one of those programs doesn't necessarily cut it. So rather recently, what we've started doing is dual enrolling people who are in ESG and in the Permanent Supportive Housing Program in the State Housing Stabilization Fund, as long as they're eligible, to bolster those households with some of the allowable activities. For instance, if we're identifying that one of the reasons we're having problems with a participant in the rapid rehousing program is that we can't reach them, well, the State Housing Stabilization Fund right now, at least for my agency, has more money to address those types of hard needs, those urgent needs. And we can dual enroll a household that is, let's say, in ESG for rapid rehousing. We can build a rental assistance bucket on State Housing Stabilization Fund because now they're housed, they've been placed. We can buy them pots and pans and a sofa and fix their car so they can go back to work, so they need us for a shorter period of time, or pay for their plumber's license renewal, which is something we did recently for a gentleman who came out of incarceration. And noticing that we're able to not that anything we're doing is rapid, because like the housing stock is the housing stock and vouchers take how long they take. But we are more quickly, I'm noticing, moving people through our funnel. And that's where I'm going with this. We developed a funnel where going forward, when we renew in July with ESG, I get a very small bucket of money for rental assistance, lights, laptops, everything, outreach. It's all in one bucket. And if I were to try and serve somebody for 2 years with that, even though I technically could, it wouldn't be wise to do so. It's better to enroll them in ESG, do the housing placement, the case management through ESG, give them their first in security if they're literally homeless, and then immediately dual enroll or exit to State Housing Stabilization Fund. And the same can be done with PSH. For a couple of reasons, there's benefits. You're recertifying people every 90 days with State Housing Stabilization Fund, and there's more money to buy things that people need, which often really increase housing stability, which I think really supports that housing first model. You're meeting all those basic needs so that a person's not just in an apartment sleeping on the ground with a mattress. They're now in an apartment with the dignity of a bed, a sofa, the pots and pans they need, and they're not thinking about those basic needs. They're thinking about their housing stability goals, which is where I want them.
Thank you, Freeman. Just on the point of co-enrollment, that you've got that housing stabilization fund is a really great opportunity to supplement and complement services. And for anybody on the line who works with veterans, there's a lot of effort right now in the veteran space to promote what VA is calling their one team approach. But essentially what it does is it breaks down those silos between programs and allows for those complementary services, even across a traditional housing program. So co-enrollment between transitional and rapid rehousing settings, co-enrollment between rapid rehousing and PSH, where say rapid rehousing has more capacity to do housing navigation services. PSH is able to focus more on the clinical side of the work. There's a lot happening in the VA space. So if there are VA partners on the line or SSVF or Grant Per Diem, you hopefully are hearing and beginning to implement a lot of messaging out of the VA's national office around co-enrollment and complementary service packages that may be useful kind of lessons learned as we think about the civilian population or other specialized populations as well. I think youth here is a good example. Older adults connecting to GEC care and other types of clinical support is also another good example. Anyone else? We do have some more slides we're going to get through. We have about a half hour left. Anyone else want to comment off mute before I move us into the next part of the discussion, some of which will be a little bit redundant to this conversation, but we'll dive into it. So I'll give it a second here.
Of course, I want to speak again. The only other thing I would say is we do try to match people to the appropriate housing resource, but we also offer them the housing resource we have available. And if you have anybody in your agencies or projects or whatever who needs a different type of housing, please reach out to me. Because we do have a procedure to transfer people to different projects. And let's not talk about match anymore. That can go away.
I know. I wanted to highlight that. And Christy, I think that's a good setup. And I think some of what is already happening in New Hampshire falls in line with this. But as we think about, what does that mean? We're not going to get into, well, Christy and team, feel free to chime in on New Hampshire specific process. But we wanted to give this kind of broader overview that I think the state has made progress in many of these areas, or is kind of midstream in some, around what does it mean to think about housing first approaches in a broader court entry process, right? So Chelsea really dug into, you know, the programs or types of interventions and how those are related to housing first. And in future sessions, we're going to dive more deeply into that. What does it really look like from a shelter perspective or outreach perspective? But we have to use those. But ultimately, those programs, especially in New Hampshire, where you've got a lot of strong leadership coming out of BHS in terms of trying to create standard policies across the state or across the balance of state, your programs have to be responsive to how the court entry process is defined, and the court entry process adapts and defines based on what programs are available. You know, to Freeman's point, when you are not only in a finite housing resource environment, but also your other mainstream programs. So as we think about it from the 4 primary components of coordinated entry, which we've done trainings on in this space before, the first being access, making sure that those access points are clearly defined and easily accessible and culturally diverse. So there's been a lot of mapping that has happened across the state around ensuring that folks who are in a crisis, whether it be via 211 or physical access points, have somewhere to go. And there's always then a question that we continue to ask ourselves, no matter how often we've answered it, is, are those access points accessible? Is the ability to connect with someone either virtually or physically apparent to the broader community, and particularly the community of people that are more likely to fall into a crisis, those in poverty, those from marginalized groups, those that may be in areas of the state that are less service rich and there are less connections. And then within that, do we have a culturally diverse way for folks to do that? So for instance, we've seen a lot in certain cities. There are predominant, either religious affiliations or other sort of cultural affiliations where those cities or states really need to adapt their services. There are, this isn't quite as true in New Hampshire, though I think it is in some areas where I've worked in states where predominantly their shelter and outreach staff are bilingual and speak, Spanish or other languages that are predominant. There's a portion of the city of Boston where the primary shelter and outreach settings, those folks have to speak Mandarin because it's got a heavy Chinese population. There are other parts of this state in this country where you may have predominant Muslim populations or Jewish populations or other types of religious affiliations that we have to be responsive to, right? In an outreach setting, it is not necessarily something that we don't prioritize based on religion, but it's good to understand how folks' religion or spiritual followings or other types of cultural identifications are going to contribute to their ability to work with you, right? And that also means that we look for those unique places or programs where those groups may be engaged. In the veteran space, we see a lot of success within, veteran-related networks and some of the sort of local clubs and other sort of support systems that exist for veterans or military personnel. In other places, we may see that certain racial populations are either congregating or interacting with certain types of services or even sort of community events. We may see that within school settings. We may see that within cultural events. We may see that within places of worship. Right. So what are the areas where we may be able to engage with people who are otherwise not necessarily going to either have the desire or the capacity to find us that we need to find out there? In this state, this includes folks that may be living unsheltered in the woods or up in the North Country or parts of the state that are extremely rural or in the mountain areas. What does that look like from an engagement perspective when somebody is not camping necessarily on the streets of Manchester or Portsmouth, but are actually camping in the White Mountains or in the National Forest? Those are likely to be folks that have different needs and desires for what types of services they're going to engage with. And that then transcends into how we develop our access and outreach points, the staffing that we do that with, the mapping we do around that, and then moving into, as people access our services, how do we assess folks that is client-centered and trauma-informed? One of the things that we've talked about a lot, and I highlighted in the chat, as well as Mandy, was this sort of need for these really robust relationship building conversations and efforts from the get-go. Most people who are homeless historically have been denied services or denied trusting relationships or been told no or disempowered for parts or much of their life, right? Other systems have failed them. If we think about marginalized groups and disproportionality in things like criminal justice or foster care, if we think about the way the general population and some political leadership across our state and country will view or speak about people who may be homeless, we know that folks, the engagement that we have with people may be the only true opportunity for authentic engagement that person has had with some sort of system of care. So when we're assessing folks, that's where we talk about that phased assessment approach that we've been promoting. And I know Mandy's team has continued to put policy around here in the state of New Hampshire. We do not start with a scoring sheet that asks them to tell us everything about everything they've done wrong in their life so that we can assign a point value to them. Part of a phased approach is that relationship building aspect, working with them to try to understand other types of supports, looking at how we can use motivational interviewing, we can use client-centered counseling, we can use harm reduction approaches to try to help people. You know, to Freeman's earlier point, there are plenty of people who are actively using drugs and alcohol or have active mental health issues in this state who are not homeless and will never become homeless. So it's often only on those folks who do fall into homelessness that we place these conditions on their ability to retain housing. And oftentimes we rest their ability to retain housing based on whether or not they're willing to accept or engage in services relative to that mental health or substance abuse disorder. So are there ways that we can use that phased approach, employ those practices, which require training, and really be intentional about how we're accounting for their life experiences as we're assessing? That is why your current assessment tool is not designed to be used the day you meet somebody. It is designed to be a disposition of, a recording of information that you have likely been able to collect and understand in building that relationship. I put in the chat earlier, and this is really falls in this assessment bucket, and this is not a training on diversion, but I think we're missing huge opportunities across this country to help people connect back to their housing unit where you have unlawful or expedited evictions where they don't need to leave the unit, and simple legal services or mediation would be able to negotiate that. Most landlords don't want to evict people if they can help it. If we can create an environment with kind of a mutual benefit between the landlord and the tenant. Many people have family and friend supports within their community that we can tap into that may take that mediation, may take that service connection, may take a little bit of a leap of faith for folks. I've had people in my family who, without support from my family and my house, my physical house, would not have had a place to stay for a short period of time. And we were willing to take them in. And that is because they asked for that help. But there are many people who will not ask for that help, or where bridges have been burned, maybe not all the way down, but you know, they're charred out pretty good, and we have to recreate those connections. But if we can think about assessment not as the pipeline to a waiting list, but rather the active collaboration with people to try to end their homelessness as quickly as possible. Some of those folks that we've been talking about that have, you know, severe and persistent mental illness, who have significant substance use issue, have significant traumas and health conditions, may not have gotten to that point if we had an opportunity to intervene earlier and find other creative ways to link them to housing. So assessment should be seen as a process that allows us to explore housing options at any given point in somebody's crisis, not as our pipeline or first step in a process to put somebody onto a waiting list that they may not be able to move off of with a housing subsidy for quite some time. Then as we move along in that process, right, we are helping people access with those creative ways. We're making sure to reduce that barrier, both in terms of their own barriers and vulnerabilities, as well as the paperwork and the rules we put on conditions of occupancy or conditions of engagement. We are working through the assessment process, not to assess the pipeline to the waiting list, but to assess how quickly we can find an alternative to them being homeless. Some people may be uncomfortable, but they won't be homeless as long as they're safe. Others will then need to go through our longer term prioritization policy, right? We're not going to be able to divert everybody. Most people, or many people who end up homeless for a period of time, will need some level of support in order to re-access housing, even if that's light touch, and in some it's going to be a much deeper level of support. So our prioritization policy is necessitated by the fact that we don't have enough of the right resources for the right people at the right time. And we have to make collectively, or you all collectively have to make the really difficult decision between two people who desperately need help, and there's only one slot or resource available. How do we make those really difficult decisions? It is not to say that anybody who's homeless doesn't need help and should remain homeless because they can figure it out themselves. But it is to say that if we don't have enough for everybody, the way that our resources are defined now and the demand on those resources, we have to have a way to make those difficult decisions. And that is what Christy spoke to, right? How do we make sure that housing is prioritized as part of coordinated entry, that system is dynamic? And, we've talked about this before, where the sort of interim model from everybody, it gets, we sort of throw everything at everybody who walks in the door, to a heavily restricted model is allowing that system to flex, to say, yes, this person has significant vulnerabilities that we've identified on paper, but they have assets within their life that may make them successful within a rapid rehousing program. And if that doesn't work, maybe we can escalate to PSH because we've tried that stabilization of housing and it's not going to be a good fit. Others on paper may not look like they necessarily need PSH, but perhaps there are other circumstances that we bring together in case conferencing to talk through that and to try to make the best decisions that we can, or at least make the best offers of housing that we can. And that allows us that flexibility, right? And we're reserving those more intensive resources for those who are more vulnerable. But if those resources and intensity of resources are not available and somebody can safely live in housing on their own, and I know there are some folks that cannot right away, then we're able to offer them some other intervention, right? With housing as a stabilizing force, we may need to take chances on some people. It may be that some people are unsuccessful, that we try to, of course, mitigate against that. And then we use our PSH portfolio to really try to hone in on those folks that are least likely to succeed without that deeper, longer term subsidy. So from a core entry perspective, we also consider equity. Somebody had put in the chat earlier when we asked about the two words that New Hampshire is, quote, mostly white. Those were the two words, and that's true. But it is also true that disproportionately in poverty, and I don't know your data, so I'm not going to say it outright, but it's likely that your inflow to homelessness is disproportionately gravitating toward marginalized groups, in particular across racial lines, and also likely across gender identity and sexual orientation. Those generally are those types of populations that we're seeing inflow to. And communities are doing a great job in creating more equitable outflows around that. But your assessment tool right now begins to account for some of these, right? Begins to account for the types of systems people have interacted with over their lifespan or over their time that predominantly or gravitate more toward those marginalized populations. Again, criminal justice is a really good example. We know that at least nationally, folks who are Black or Indigenous or people of color are more likely to have been engaged with and been incarcerated by our criminal justice system than their white counterparts, even for the same infractions or crimes. And so knowing that, we also understand that criminal histories then transcend into housing opportunities and options, and that then transcends into that inflow of folks that may become homeless because their past criminal histories or credit histories or whatever it may be are leading them not to be able to access permanent housing on their own. And regardless of whether or not those criminal histories are rested in truth in that person's history, we know that it is going to contribute toward a more inequitable foundation for their housing goals. So part of our focus on equity is trying to understand those nuances through those problem-solving approaches, through that phased assessment, looking at data and trying to understand disparities at both the system and program level. At the system level, are there differences between racial or gender identities on the inflow side, on the assessment side, on the referral side, on the housing side, and on the retention side? Throughout the continuum of services, are there areas where folks of different identities are failing more often? And are there ways that our system can adapt to that, and also our programs? There was a really great example of a rapid rehousing program I had worked with in the past, and some of you may have heard this, that recognized that their intake, their time to lease up, and their initial income and employment connections were consistent across racial populations. I think this was predominantly for males or for men. And but what they were seeing was Black men were returning to homelessness at a higher rate or at a quicker rate than their white counterparts after program exit. So that project level looked at their data, looked at the different reasons that might occur, and realized that those folks who were leaving with employment at consistent rates, their white counterparts had longer lengths of employment prior to program exit than did their African American or Black counterparts. And so their employment in their white cohort was more solid, right? That first month or 6 weeks is always, there's always a learning curve. That's your probationary period. That's when you find out whether this job may hold or not. And so while the overall enrollment characteristics across racial lines were consistent, the exits were looking different, and it was partly because their employment partners and their employment opportunities had disparate impacts across racial lines. They adjusted their program to put in more concrete program exit planning, which they coordinated with their continuum of care and their case conferencing team, and they saw that those outcomes began to align, where the white counterparts or the white cohort was continuing to see a similar level of success, and their Black counterparts of the same age group of men were coming up to those similar success rates just by making adjustments to their exit policies as a continuum and then within that program because of the disparities they saw. So using data, that wasn't a hard change. They added a level of supervision and a level of review around what that income and that job looked like. They did a little bit more outreach with employers and the participants to figure out what was going to stick and what was not as far as income supports. And that gave them a better informed opportunity to either exit that person from rapid rehousing or continue to keep them enrolled for an extra 4 weeks, 6 weeks, 8 weeks to make sure that that income stream was real and that was going to be sustained. That little change made a difference not only in the aggregate, but at the client level and who was having a more successful tenancy that otherwise may not have because their employment was not solid yet. And then we used all of these things that we learned to elevate people with lived experience to provide that feedback. I know the state's done good work here. I would say, regardless of policies that require this at the organizational level, we are a country of predominantly, based on the data, white middle-class social workers, right? And it is not necessarily true that white middle-class social workers are the people who are experiencing homelessness. So how do we use our organizational capacity, our hiring practices, our kind of system partners to really elevate those that have lived experience of homelessness, those that look like and have similar experiences to the people we're trying to support, so we can create those pieces. And then this comes down to creating policies on funding that I'm sure Christy can chime in to as well. But part of this is about the money. The 50 people on the line, some of you don't agree with anything I'm saying right now, or someone that might watch the YouTube video may think this is ridiculous. People need to lift them up from their bootstraps, and they need to get sobered up and get back into housing. But frankly, your funding sources are now compelling you to do this work. So if you don't like what we're saying, you can either not chase the funding, you can fib or make up what you're about to do on your funding applications. You can find a new line of work, right? The funding priorities from HUD and from the state are that we are committing to housing first, that we're looking at those reasonable termination and mediation policies now being audited by the state of New Hampshire. We're committing to low barrier access, and we're going to talk about in future sessions, low barrier access versus unsafe access. How do we create those spaces? And that's another topic. And funding that monitors that oversight. Are you denying referrals from coordinated entry for arbitrary reasons or because you don't think somebody's housing ready? Are you creating greater documentation burdens that are making it more likely that somebody will disengage from services prior to their housing opportunity? Are we able to work as a community to work together to support those clients through case conferencing, through barrier busting, to Freeman's point earlier, to braid and blend programs and enrollments to meet those unique needs where one type of project cannot support a certain types of cost or service? How do we then infuse other types of services or costs that may be available and bring those together in a coordinated way? And we focus all of these components on permanent housing. Now, we often, to the chat point earlier, are the ones who are working to absorb the failures of many other systems of care, right? But our primary job is to end homelessness. We are not always going to end poverty, though we need to work on income in order for people to be able to sustain housing in many cases. We're not going to be able to solve substance use disorder in this state or this country, though we need to work with people on strategies to be able, if they are actively using, to do so in a way where they can sustain their tenancies or where they can have the supports that they need, right? We're not necessarily going to be able to help people resolve their past criminal histories or credit histories, but we can create landlord relationships as partners and standards with how we work with landlords to make sure housing access is available. It was mentioned earlier about having dedicated housing owners that have units available. That only happens when you can create commitments that people can stand up to and can feel comfortable around. And that then leads us, and we talked about this in our last session, to what the outcomes look like. It may be uncomfortable for us sometimes, but the outcomes speak for themselves and how we see people moving along. We decrease that length of stay in shelters writ large, and oftentimes for very specific people who have greater needs. We're reducing lengths of time to housing placement by reducing those, say, paperwork burdens. To the point earlier, if it takes 3 weeks or 2 weeks to figure out how to get somebody's ID, you've now lost, and you don't need that ID for some programs, you've now lost 2 weeks and that person has spent 2 more weeks traumatized in homelessness. If we can set these systems up right with those progressive assistance models that Christy spoke to in your policies, we can decrease recidivism into homelessness. We can keep the length of time housed longer. And what we've seen in other states where they've done the data, and I'm sure it happens here, though I don't know if we have the data, that those who are most unhealthy that become housed are decreasing their ER visits, they're improving their health conditions. So if we need another argument beyond everything we've said, not only are your funders making you do it, not only is it a best practice, but frankly, our tax-paying dollars are paying for fewer health emergencies for people who are in housing. It is expensive for somebody to be homeless. It's very, very expensive to our state, to our local communities, to the federal government, ultimately to us, to have people lingering on the streets. And so even if you think they got to pull themselves up on your bootstraps, if you're just worried about where your tax dollars go, the more that we can think about housing as a social determinant of health and a way for us to save not only lives, but dollars and how those dollars interact with lives, that all contributes toward this. The least healthy people are those that are harder to house with the highest level of health related costs that we try to change. And then, of course, increasing economic well-being. One thing that we wanted to mention before we start to close out here is that all of this requires training, right? And many of you work in nonprofit organizations, and I think the state has done a great job of trying to create, I think there's a YouTube channel, I don't know if the link went in there, 2 different trainings. The National Alliance to End Homelessness does a lot of great training. We hope to provide value in this setting as well. But we need to make sure that if we're going to be working within a housing first environment, that not just the folks on the line, but all levels of your staff understand that. We can't have housing first shelter settings if our intake staff have not been trained in some of the interventions or approaches that you see here. Things like, what does diversion really mean? What does housing problem solving mean? What's different from that than come in, doing a basic intake and providing basic safety needs? What is trauma-informed care, and how does that work both from a clinical and non-clinical level? How can you do motivational interviewing even if you're not trained to do so? Again, from a clinical or certified level, how can you use the principles to help people work through their goals, to help them be safe when they're actively using or in mental health crisis while still retaining tenancy or working toward their housing pathway? what does it mean to understand our implicit and explicit biases, right? I'm a kind of, what do you want to call it? Middle-aged, middle-class white guy from New Hampshire. I do not have a similar experience to an African-American female from Seattle, right? I'm going to inherently have biases, whether I like it or not, when working with people with different racial or cultural or economic backgrounds. And that doesn't mean I can't work with those folks, but it does mean having an understanding of where those biases come from, how to mitigate against those biases affecting people in a negative way is really important. And that happens from the custodian at the shelter all the way to the CEO of the organization. Every level of the organizations, people have biases, and those biases contribute in some way, either negatively or positively or in a neutral environment, toward the experience of participants you're working with. So with that, we have a final discussion, but I saw that the chat was grazing my eye over here. So we did want to just sort of open up for other strategies that folks have found effective. As you've come along in your journey on Housing First, what opportunities do you think there are for growth? So where are some of the gaps that you'd like to see all of us across the balance of state continue to harness? Or if Chelsea or Christy have seen something in the chat they want to highlight or bring up here before I have a chance to read it, we can bring those in as well. So we've got about 5 minutes. I'm going to pause and just open up the call, and I'm going to take a look at the chat. Whoops. I'm going to stop sharing. Anybody have thoughts on areas that you've seen for growth, success that you've had in your organization that's worth sharing with others? Areas of concern that you have around Housing First that you'd like to bring up? This is a safe environment to have these difficult conversations, though we only have a few minutes left for them.
Just want to see more openings for the severely and persistently mentally ill. I want to see like integrative housing, and I want to see all the CMHCs pluck their openings from coordinated entry. Cherry picking your easy clients that stay engaged with you, like that's not going to make a dent in the Main Street issue. Got to serve the ones that nobody wants to help, and showing success with the hardest to serve is, I think, how you can prove to everybody that you're the lighthouse and this is the way to do it.
Thanks, Freeman. Well, you've been with us now for about 88.5 minutes. So I'm going to see Christy, I think we're about ready to close out here. I want to turn it to you for anything that you'd like to offer before we give folks their day back.
I don't have anything else to offer. I love the comments in the chat, and I'm really enjoying this Housing First training series and having all of you here together. I will send out the PowerPoint slides, and once I get the video uploaded to YouTube, I will share that link as well. We will compile an entire list of all the links for these trainings once they're done in November for everyone as well.
Okay. Well, thank you, Christy. Thank you all for being with us today. I just want to call out Chelsea from our team here at TAC. Thank you, Chelsea, for your comments and really the engagement in the chat and on the line. We will reconvene, I think it's next month, for our next session to start getting into more of the program level. Our next session focused on outreach and shelter settings. That will be another session which we're going to be inviting a lot of discussion, because I think oftentimes the greatest expertise on these trainings are you, not us. So come ready to type away or speak. But we will see you all again in a month. I'll send out the slides to Chrissy, who will distribute them out. Thank you all. Have a good rest of your Wednesday afternoon, and we'll see you again soon.
The next training is June 20th, and then we reconvene in September. We purposely did this because of the NOFO for Continuum of Care and YHCP projects. So we will see you in June.
Thanks all.
Thanks.
Thank you, Doug.